Peter, thank you very much indeed. Croeso wrth gwrs I chi gyd yma at y Cynulliad Genedlaethol Cymru. Welcome to you all once again to the National Assembly for Wales. I'm really very pleased indeed to be here to help to mark World Mental Health Day for 2013 and to lend my support again to the Lights, Camera, Action campaign. And just to say how much I agree with both Karina and David in saying that the word action is in capital letters for a reason, isn't it? It is about the actions that we can now take here in Wales to continue to improve mental health services. Every day, World Mental Health Day reminds us of the importance of raising the profile of mental health issues, and it allows us to learn from other places as to services that are being developed there, and every now and then to blow our own trumpet a little bit about what we are achieving in Wales and to show how keen we are to spread the messages of things that we think we have managed to achieve here so that other parts of the world can share in our experience as well. Because there's no doubt, as you will all know, that mental ill health continues to pose really significant challenges, particularly challenges for users and their families, but also challenges for services and the way that they are designed and delivered as well. And here in Wales we have a formula, at least, in which we try to blend together the work that statutory services do, the fantastic contribution that we get from third sector organisations, and then the voices and the experiences of people who are part of those services every single day. And Lights, Camera, Action, which I've been very privileged, I think, to have seen it at the beginning, to have seen it in practice out in my own constituency in Cardiff West, and now to be here today, I think really has been both dynamic and innovative. It's brought together that range of organisations in Hafal, Bipolar UK and the Mental Health Foundation, and captured the voice and the experience of users and their carers to tell us something important about the state of mental health services in Wales and to give us new ideas about how we can go on making those services better for the future. And it's been great to have heard directly from the mental health service user and carer panel members today, and I really do want to applaud the panel for all the enormous hard work that they have undertaken in helping to make this campaign such a success. Now, I talk a lot, I talk too much probably, but I talk a lot wherever I go about the idea of co-production and the way that I want to see that idea embedded in the way that we think about, design, deliver and experience services in mental health and in other parts of our health services here in Wales. I really think you can begin to see this now happening at all levels, as you have already heard, very much echoing what David said. Co-production is an idea that has at its heart the belief that people who use services are experts. They are experts in their own lives. They bring enormous strengths to the services that they use. And what we haven't been good enough at doing in the past is recognising that expertise and capturing it in the way that we design our services and deliver them. The question we need to ask about people who use services is not what they can't do, but what they can do. Not what their deficits are, but what their strengths are. And then to help them to build from those strengths and to contribute those strengths into the way that we design our services, engaging service users, their families and their carers at a national level in places like this National Assembly, but also then at local level in planning services. When people are involved in the planning of their services, they get the trust and the confidence that they need to make sure that they're receiving the right treatment and support. And then all of this really does work out as well at the level of the individual encounter between somebody using a service and somebody providing it. And I've been really heartened today to hear what you've heard already about the production of personal care and treatment plans for individuals receiving secondary mental health services. It was one of the things set out in the legislation, the mental health measure passed here in the Assembly, and to hear that it is making a difference, that we can see those ideas really happening, that an effective care and treatment plan really will reflect the individual needs of service users and help them to ensure that they are on the road to recovery. Now, we know that if you are facing a mental health difficulty, that isn't just a health difficulty, but that it will have an impact in many other parts of your lives. Managing budgets, caring for children, performing everyday tasks, all of these things can have additional challenges. And that's why our care and treatment plans aim to take a view, not of the patient, but of the person. And the person is something much broader and more important than simply a patient. They are somebody who have lives of their own, of which mental health is a component. And our aim is to help people to see that getting better across the range of things that they do. And I think it's been one of the most encouraging and exciting things that the Lights, Camera, Action project has achieved, in that it has given people a voice, a direct voice, can be heard by others in all of that. And just finally to mention, as we mention every time, that one of the fundamental purposes of our approach to mental health services in Wales, and to which this campaign will have made a major contribution, is in addressing the enduring sense of stigma that is there in relation to mental health. And one of the ways I think we are genuinely lucky in Wales is that when mental health matters are talked about on the floor of the Assembly here, right across all political parties, there is a strong shared determination to tackle that issue of stigma head on. The First Minister, in questions here in the Assembly on Tuesday of this week, was asked a question about some of the things that we have seen going on in parts of the media and parts of advertising over recent weeks. And he condemned those things without reservation at all, and there was a shared sense right across the chamber of how we need, not in a passive way, to think about stigma, but in a positive, standing up, speaking out type of way, to make sure that we get those messages out there, and having people speak out themselves is a really important way of making that happen. So many congratulations to all of those of you who have been involved in the campaign. World Mental Health Day is an extra special chance to celebrate it. I'm looking forward very much to seeing a small selection of the results and to sharing with you the results of the project. So diolch yn fawr iawn i chi gyd am gwrando.